All right, good afternoon. Thank you for coming in. My name is Amber. I am the clinical social worker that has been assigned to you. If you would please share your name with me.
My name is Jennifer Cole,
And how do you spell your last name, Jennifer?
Cole.
Okay. And Jennifer, what is your date of birth?
My date of birth is 2/25/69.
Okay. All right, so just wanted to verify that information. I know there was a brief intake done to schedule the appointment. And could you please tell me who referred you?
I was told, I wasn't told, it was recommended for me to come here by a family member.
Okay.
Yeah.
And before I ask the next question, I just want to restate, because I know on the form you signed out in the waiting room, it explained about the fact that I am a mandated reporter. So anything that we discuss here in this room today will stay between us unless you indicate that you wish to cause harm to yourself or someone else. Okay? Any questions regarding that? Okay.
Nope.
All right. So let's slide right back into the questions here. Why did this family member refer you to come in and speak with me?
So I have not been going into work. I have a job that we used to work in the office, and then in COVID, it moved to an at-home format. And about maybe like 5.5 months ago, they stated that it was time to come back to the office, and I have not gone in since they've told me it's time to come back.
Okay. And so were you given the option to work from home, work remotely?
Up until about 5.5 months ago, when they said it's time to come in, they've kind of given me some kind of grace period,
Okay.
but that's going to end soon.
Okay.
So the family member, I was discussing it with them, and they thought that maybe it's something you could help me with.
Okay. So just make sure I understand correctly. So you're working in the office, COVID hit, and then as things started to open back up and workplace said, come on back to the office,
Mhm.
you requested to stay home. And so for the
Mhm.
past 5.5 months, you've been working remotely, but
Mhm.
that's coming, your extended time period. Um, did they tell you you need to come back into the office or we're going to have to let
Mhm.
you go type of
Yeah.
situation? Okay.
that's,
Okay.
that's the
Okay.
extent of it.
Okay. And so let me ask Jennifer, why why haven't you gone back to the office?
I just actually I don't think I can face it. Before COVID, it was, and I didn't even know it was like that, but it was like when COVID hit and we all started working from home, it was such a tremendous relief to be able to work quietly in my home. Being in the office, and it's only, I didn't even know it was like this, but the level of stress and having to kind of perform in front of other people. And it's not that I have a performing job, it's more just that I'm there working, the whole day in front of people. Like, we work in cubicles. Every phone call I make is overheard. I feel like everyone is listening to me and watching me, and you're kind of judging everything that I do. So, now that I've had a period of time where I haven't had that, I cannot even imagine even walking in that door.
All right, yeah, that does sound like, you know, so that does sound pretty intense.
Hmm.
Well, thank you for sharing that with me. Before we go any further into that line of questioning, I'm going to ask some background information just to give me that whole person perspective, so I can make sure that I'm doing my best by you. Let's see. All right. So, have you seen a psychiatrist or a therapist before?
No,
Okay. And have you ever been administered any psychiatric medications?
no,
Okay. And have you ever been in a hospital setting as an inpatient for anything other than routine surgeries?
no,
Okay. And have you ever expressed to anyone, or have you ever experienced any suicidal thoughts? Any thoughts of harming anybody else?
no.
Okay. And then family history. Is there any family member that has a history of behavior, mood, or anxiety, trauma, substance abuse, or any other disorders?
No, my dad, he had he didn't like going out too often.
Okay. Would you describe him as more of a homebody?
Mhm,
Yeah. Okay.
definitely.
Okay. But no official diagnosis that you were ever.
Not that I was ever told, no.
Okay. All right. And do you currently use drugs recreationally or drink alcohol?
No.
And have you ever used drugs or alcohol in the past?
I used to drink.
Okay. When was the last time that you drank?
Probably maybe like 5 years ago.
Okay. Any particular reason why you stopped drinking or?
No, I did a 28-day challenge,
Oh, okay.
and then well, I kind of drank a little bit here and there after that, and just never really got into it again.
Okay. Okay. All right. And who did you grow up with?
So it was me and my brother and my mom and dad.
Older brother or younger brother?
He is my older brother.
And what is your relationship like with your parents?
It's pretty good. I see them. They come visit me. It was actually my mother who told me I need to come see you.
Okay. And what about with your brother?
The same. Like he's the opposite of me. He is very social. He loves being out and loves being the center of things, and kind of complete opposite to me. So I like to see him in my home. I don't necessarily go to his home. It's very loud and rambunctious, and
Yeah.
not my thing. But he sees me every so often.
Okay. And have you ever been married before?
No,
Okay. Do you have any children?
nope.
And what is your highest level of education?
Bachelor's degree.
All right. And are you currently employed?
Yes.
Okay. Full time? And I'm sorry,
It's full time.
I answered a question I asked you a question I already knew the answer
Yep,
to.
that's okay.
Thank you for
Yeah.
entertaining me and answering it again. So I'm
Yeah,
looking
no, it's
full
okay.
time or part time?
Full time.
Full time. Okay.
Mhm.
And what is it that you do?
I work with data. We track information and on different things for different companies.
Okay. And have you had any stressors within the past 5, 6 months?
No, only only being asked to come back to
Only-
work.
Okay, fair enough.
That's been the most significant. I find that if you stay at home long enough, you can eliminate most of your stress.
Ah, yes, controlled environment, right?
Exactly.
And you're the one who gets to control it, nobody else.
That is very true.
And so is it safe to assume you live alone?
I do.
No roommates? Okay. And is there any history of military service in your immediate family? Yourself? Okay. All right. And do you have a history of verbal, sexual, or physical abuse?
Nope.
All right. All right. And what is your, who or what consists of your support system?
I'd say it's primarily my mother.
Okay.
I'd say my family, but I'd say her in particular.
Okay. And do you have a history of legal problems or any legal stuff going on at the moment?
Nope.
And do you have any current or past medical conditions or issues?
No.
And let's see, are you using any non-psychiatric medications, heartburn or anything like that? All right.
Nope.
Any history of a head injury?
Nope.
All right. And then any allergies?
No, or none that I know of.
All right, perfect. So just based off the brief information that you've given me, I'm going to ask some more specific questions just to give me a better idea of what we might be looking at. And hopefully, you know, this will help me and you find some answers of what why now after being home, working from home, why the strong resistance to go back. Okay.
Mm-hmm.
So during the past several months, have you frequently been worried about any number of things in your life? Anything in particular?
Well, I'm kind of afraid I'm going to lose my job. And on one hand, I kind of feel like, well, fair enough. If they want me to do something I can't do, I'll lose my job. But in reality, I can't lose my job. So I think that's my primary stressor right now.
Okay. And do you find that it's hard for you to control or stop worrying about this?
Mm-hmm.
Okay. And so just like to explain or describe, so a panic attack is it's a sudden rush of intense fear or anxiety that comes on from or out of the blue for no apparent reason, or in situations where you did not expect it to occur. Would you say you've experienced recurrent panic attacks surrounding this? Okay.
No.
And so this experience has ever caused you significant trouble with your friends or family at work or in another setting?
Yes.
Okay.
Yes, definitely, with both.
Okay. And would you mind giving me an example?
Well, my family, we've always had, like big dinners at their house where it's like extended family too, not just them.
Okay.
That ended, say, for COVID. I was a reluctant participant before that,
Okay.
but I've refused to go since, everyone's kind of been back together for the last year or more. So that's causing issues. They feel that I should just come, and I don't feel that I can come. So if it were my mother, I'd have no problem. I could, have her over to my house. But, the idea of going there and into that room I can't even imagine doing that.
Okay. So just to restate, if I'm hearing you correctly, if you are invited to go into an environment where you are not in control of that environment, it causes these physical reactions, and that you would prefer to have just maybe one or two, like just a few people over to your
Not
place
even sure. I think I just
or...
would like to see. No, I don't even want to see any of them. I think it's more just like I'm good with my immediate family and kind of small, like my mom I'd see often.
Okay.
But I do think that if it kind of gets bigger than that, it just becomes, I feel that they're, I suppose, judging me. But if I leave the room, I feel like they may be talking about me.
Okay. Okay. Let's see. All right. So when you think about going over to someone's house, do you think about do you start feeling anxious or worried? Do you feel like, say, restless, on edge, or keyed up? Okay. Okay.
Oh yeah.
And do you find, like, when you come home from these events, that you feel fatigue, like more so than normal?
Oh, and I used to go, my goodness, like if I went, if there were things that were, say, 2 days in a row, I would not go to that second thing. One
Okay.
thing is more than enough.
And do you find that when you're in these settings that you have a difficult time concentrating on the conversations that are being held, or about,
Yes.
okay, okay, hard to concentrate? And
Hmm.
do you ever notice your mind going blank, like you're going to say something and then,
Hmm.
okay, all
Yeah, and I can't even, and I didn't even listen to the question either. That's the other thing. I don't even know what they said.
right, okay. And when you're in these settings, do you find yourself getting irritated or easily annoyed by someone that normally, if they wouldn't, you wouldn't experience those emotions?
I think maybe after the fact, I think when I'm in the moment, I'm so like inwardly kind of thinking about what they might be thinking of me. It's really after I
Mm-hmm.
might have time to think like that, but in the moment, no, I'm thinking, get me out of here.
Okay. And then are you able to, again, surrounding these experiences, do you notice when you're anxious or you feel worried that your muscles tighten, that or
Hmm.
shoulders are tense, anything
Oh
like
yeah,
body? Okay.
definitely. Hmm.
Okay. And then one more question, and then we'll wrap up for the day. Do you find it difficult to fall asleep or stay asleep or experience restlessness or unsatisfying sleep after going out to an event like what you described?
I do. I tell you, I'm most restless and most, have insomnia when I'm coming with the idea of when it's coming, when I'm thinking about having to go to it. Like when I'm thinking about having to go to work now, I find it very difficult to sleep.
Okay. Okay. Well, thank you for answering those questions, for being vulnerable with me, and taking that deep dive. It when I'm doing my write up from this assessment today, it'll give me a further glimpse into what we may be looking at, what you're experiencing, and then from there I'll be better able to assist you and to help you um, move forward. Okay.
Great.
So
I'm
it was
excited.
lovely meeting with you, and I look forward to seeing you next time.
Thank you very much.
You're welcome.